Hello and welcome to Health 247 on Rapid TV, the program that brings you trusted health insights, expert advice and inspiring stories. In this edition, we will take a look at the just concluded 2025 National Nutrition Week and its lasting health benefits. My name is Josephine Bitrus. Thank you for staying with us. While National Nutrition Week is celebrated worldwide, the dates and themes differ from country to country. The aim was clear: to raise awareness about the importance of proper nutrition and healthy eating habits. In Nigeria, the Federal Ministry of Budget and Economic Planning marked the week with a two-day dialogue that gathered participants from the Federal Capital Territory, Abuja, and beyond. Here are highlights of key topics discussed at the event, along with insights that matter for a healthier Nigeria. National Nutrition Week in Nigeria began in 2012 as an annual campaign to tackle the country's growing malnutrition burden. Held every November, the week creates awareness about healthy eating, nutrition education, and government efforts to improve public health. It is a nationwide reminder of why good nutrition matters, guiding people to make informed food choices, maintain balanced diets, and prevent nutrition-related diseases. The ultimate goal is a healthier population and reduced malnutrition rates. The week is usually packed with activities such as workshops, seminars, cooking demonstrations, school competitions, and public health campaigns. It is coordinated by the Federal Ministry of Budget and Economic Planning in partnership with national and international nutrition stakeholders. While National Nutrition Week is celebrated nationwide, the specific dates and themes often vary from one country to another. The theme for 2025 edition is Sustainable Nutrition for a Healthier and Productive Nigeria. This year's focus is on mobilizing action against malnutrition and hunger, promoting evidence-based solutions, and strengthening food security systems. The National Dialogue held from 24 to 25th November brought together 196 participants from across the country, including representatives from the Office of the Vice President, ministries, departments and agencies, the Nigerian Governors Forum, development partners, academia, civil society groups, youth networks, communities, and the media. A nutrition specialist, Professor Ngozi Nnam, also gave a historical overview of the evolution of National Nutrition Week from 2012 to date.
Well, it started with the period I was the president of Nutrition Society of Nigeria in 2012. I observed that there is very poor nutrition indices in Nigeria, and that Nigeria is really taking the lead of malnutrition in Africa. Very poor indices and very poor situation that needs to be changed. And as the president of Nutrition Society of Nigeria, I felt that the society should take the lead to see how to improve this ugly situation. So as the president, I took the lead to meet some key persons, notably Dr. Chris, who was in charge of nutrition unit in the Federal Ministry of Health Nutrition Department then, and explained to him what I intend to do and my proposal, and gave him my proposal. He was very happy to get it approved because he said it must get approval from the Federal Executive Council before implementation. So he was working hard with the minister to get it passed on to FEC for approval before they had an emergency that took their attention, and it was delaying. And because of that, I quickly moved on to agric, since we also have a nutrition unit in agric. I met the senior special assistant to the minister, Dr. Victor Jero, who equally bought into the vision, and it was almost getting to FEC for approval before the minister was removed, Dr. Adeshina, to Agric Development Bank, and it wasn't getting the attention as before. So I moved to Ministry of Budget and Economic Planning, where Mrs. Gabriel was the desk officer for nutrition, and she bought into the idea very well that she was interfacing with the PAMSEC, the director, and they got the information to the proposal to the minister, who presented it at FEC, and happily it was approved that is Nigerian Nutrition Week. And how I got about the Nutrition Week is that I googled what are the various avenues that other countries are using to create awareness for nutrition. I saw that they have a dedicated week to talk about nutrition. In US, they have a dedicated month, 1 month long activity to talk about nutrition. In other countries, 1 week long activity. So in Nigeria, it was approved 1 week, Nutrition Week. That's the name. That's how we got about Nutrition Week. To have a dedicated week to talk about nutrition, create awareness, let the populace know much about nutrition and how to eat, what to eat, so that they will be in a state of good nutritional status to improve productivity in the country. And that was how the week was approved and celebrated. It was approved in 2016 and celebrated the first celebration was December 2016. And the highlight of the celebration was the approval of the National Policy on Food and Nutrition, and making the First Lady then Ambassador for Nutrition. And we really had a 1 week long activity. We had the opening ceremony, the launch of the Nutrition Week. Then we had seminars, we had road walk, we have sensitization to the markets, and the market people, they were all excited to learn about it.
Minister of Budget and Economic Planning, Senator Abubakar Atiku Bagudu, reaffirmed the commitment of government to improving maternal and child health, strengthening food systems, and building climate-resilient nutrition programs. Represented by the Permanent Secretary, Dr. Samson Ebimaru, he also launched a new recipe book featuring motion design graphics.
Our nation's nutrition movement is at a critical juncture. There's no doubt that we have made commendable progress in improving maternal and child health, expanding essential nutrition services, and strengthening food system. However, we face persistent challenges in stunting and micronutrient deficiencies, and the need to align policies and scale actions with rapid population growth. When the Permanent Secretary of Steel Ministry spoke, he expressed, some worries about the implementation of nutrition activities in Nigeria, that it is actually not yielding, sufficient result as we desire. And that is to say, we need to go back and look at our processes. Is process more important than result? Are we putting too much money in processes like meetings like this? Are we deficient of human capital in terms of capacity to drive the process? Because if the process is wrong, then the result, outcome, and impact must be affected. So we need to look at the process. Is it that we are not doing sufficiently what we are expected to do in terms of, is it that we don't have money? We don't have sufficient budgetary provision for nutrition activities in Nigeria. So we should go back, review that in form of, if we do adequate M&E using the efficient, well-calibrated key performance indicators, we'll be able to find out whether it is processed in terms of output, input and output that is wrong, or is it that outcome, we couldn't link them together, or from the objective of the whole program, we miss it. Because when you want to talk about evaluation and KPI, you must look at your objective. So we need to do that very quickly and know, I'm talking to the key drivers of this process, including our ministry, who is in charge of national M&E, to find out if those who have authority to say what matters in nutrition, those who have experience, those who have the institutional memory, are saying that we are not getting adequate results. We need to go back. We need to review what we are doing, because it is not sufficient to be having meetings, to be talking about nutrition, for us to be showing ourselves on the screen of national TV when we are not getting results. So we need to interrogate the process and look to the result and impact. Let me start by also informing us that the theme for this year's Nigeria Nutrition Week, Sustainable Nutrition for Healthier and Productive Nigeria, highlights the undeniable link between adequate nutrition and productive workforce and resilient economy. Nutrition is a cross-cutting issue, and it underpins the need to prioritize nutrition-related intervention on the development agenda of the nation. Ladies and gentlemen, our nation's nutrition movement is at a critical juncture. There's no doubt that we have made commendable progress in improving maternal and child health.
The Permanent Secretary of the Federal Ministry of Steel Development, Dr. Chris Osa, emphasized the strong link between good nutrition and economic productivity. He called for better coordination, data-driven policies, and stronger alignment of nutrition initiatives across government levels.
Nutrition is linked to every sector. Every sector is touched. And when you talk about economic growth, industrialization, you need a strong workforce. And that strong workforce is guaranteed by good nutrition. Statistics show that improved nutrition can contribute to the gross domestic product of a country. A country that is ravaged with malnutrition ultimately loses in economic development and growth. Steel development is about ensuring the backbone of industrialization in the country. We need a strong workforce to achieve that. But I'm not here to talk about steel and nutrition. Just wanted to let you know that I am actually not a square peg in a round hole, but I'm a round peg in a round hole talking to you today. It is no news, and I'm not going to start reading out statistics, that the nutrition situation in Nigeria is not getting better. As a matter of fact, statistics I see show that it's getting worse. Millions of our children, from 2.5 million to 3 million children, are now severely acutely malnourished. About 15 million children are stunted. These are not numbers. They are children. Either the children of your neighbor or the children of a very distant relation, but they are children. I have a story of a child somewhere in northern Nigeria, in a state in northern Nigeria, who had been sick for some days. Her father could not take her to the hospital because he didn't have money. But when he eventually took her to the hospital, this child had malnutrition. The health workers did their best to want to salvage this child. But in that facility, there was no ready-to-use therapeutic food. The father didn't have money. Health workers had to contribute money to see what they could do to treat the child. 9 days, 9 agonizing days of hope, pain, cries, prayers, and then the child died. This child died not because of malnutrition. The child died because the system didn't work to help her. The child died because there was no ready-to-use therapeutic food in the facility at that time. The child died because our programming probably didn't quite capture that. And there are many of such children everywhere in the country. Those are the 3 million severely acutely malnourished children that we talk about. So when you bring it home like that, you begin to see why we need to pay attention to nutrition. We all here are passionate about addressing nutrition. But how come that the situation gets worse? There must be something we may not be doing right. Because nobody is going to tell me that everybody in this place today is not interested in improving nutrition in the country. And so I got digging into data, trying to find out why the situation is like this. Why can't we improve nutrition? And I go back to my experience as head of nutrition in the Federal Ministry of Health. We sat down, we planned, we developed the National Strategic Plan of Action for Nutrition, which was costed. So we knew how much it was going to cost. I sang the song and it still remains in my head. We needed 912 billion US dollars to address malnutrition in Nigeria. We calculated how much each state needed to spend on nutrition so that we can change the tide.
Goodwill messages from the Vice President's Office, MDAs, and development partners highlighted continued support for Nigeria's nutrition agenda.
The fact that this event continues to grow every year in depth participation and relevance is proof that Nigeria is no longer treating malnutrition as a silent emergency, but we are confronting it as a national development priority. And so the theme this year of sustainable nutrition for healthier and productive Nigeria could not be more timely. It challenges us to move beyond fragmented programs, temporary fixes, beyond pilot projects, into one that is more sustainable. It invites us to imagine a Nigeria where nutrition is not an emergency, but where nutrition is prioritized across the country because of its necessity to human capital development. Again, I'm really grateful to the entire team here. It's not a day of speeches, it's a day of dialogue and communication to strengthen nutrition in the country. And I want to say that we understand in this country, particularly under the leadership of Mr. President Bola Ahmed Tinubu, that nutrition must be prioritized and that it must have a multi-sectoral coordinated approach. And this is why we have the Nutrition 774 initiative, which is not a program or a project, but one that is driven collectively by all of us here, of course, with the Ministry of Budget and Planning coordinating this to ensure we have a unified response to tackling malnutrition in the country.
We are not just here for a meeting, not here for a celebration, but for us to identify, look at those challenges, and bring out lasting solutions that will help us address this major challenge we have identified.
Panel sessions explored key issues such as coherent nutrition policies, multi-sectoral data coordination, nutrition financing, research translation, resilient food systems, and the role of youth and communities in driving positive nutrition outcomes.
We just need to be more intentional, like has been said by other panelists. We need to be more intentional in building our system. And it can be as simple as a spreadsheet, an Excel sheet that just tells me, this is my target population. This is the number of, let's say, humanitarian affairs. Yesterday, we had mothers receive turnaround. I'm told maybe tomorrow there'll be. So it may be as simple as this is the number of target population we want to reach with distribution of Tom Brand. This is the number we reached. These are the location where these people come from, and just maintaining that simple Excel and having it institutionalized in a place that we know that this Excel file, it will be filled by a nutrition officer. It gets transferred to maybe the director to sign off. At the end of every month or every quarter, we present to the peers.
There has been a lot of challenges that we need to address, and I think one of the key things I want to emphasize is on the capacity area. Sincerely, it's one thing to build a form, a digital form, and deploy it using ODKs or SCTO. It's another thing to know if that tool is actually user-friendly, looking at the people that we use, is at the first users, at the community. And I think that's one major issue we've also had with the use of the food system dashboard. At the LGA and at the state level, we've had major issues in terms of the usability of this form. And that's centered around, of course, people not really having that capacity to be able to effectively use that digital tool to make decisions.
Regarding how academia can play a role, I think currently academia is already doing a lot, because a prerequisite for you to even get a degree or a doctoral degree or certificate, you first need to have your research published. I think that's a good step. And if you search for any research topic, I don't think there's nothing I've said that not seen something online. So I think that's a good start. The next question will now be, okay, how do we coordinate it? How do we harmonize it and put it in a place that's easily relatable to everybody? But I think we're already on the right path. At least let every research be published, not just something that you just do and then you keep it somewhere, print out papers and keep it. So I think that's a good step.
After the discussions, participants agreed on strategic actions to strengthen nutrition delivery across Nigeria before winding down with singing and dancing to ease the day's tension. Experts say the commitments made during the week must now be backed by transparency, urgency, and sustained collaboration among government, development partners, and communities. This is Health 247 on Rapid TV. A clear definition of each ministry, department, and agency's role in the new National Nutrition Policy to eliminate overlap and boost efficiency is emphasized. Strengthen coordination led by the Federal Ministry of Budget and Economic Planning across all levels is also established. Capacity building for MDAs is equally imperative to craft sector-specific nutrition plans that align with national priorities. Expanded stakeholder engagement, particularly youth, women, religious and traditional leaders, is essential to increase ownership and acceptance. Not forgetting sustainable financing mechanisms, including tax incentives for producers of nutritious foods and firm budget commitments for both short and long-term interventions, among other measures, is also highlighted. These resolutions are aimed at tackling malnutrition, improve nutrition outcomes, and promote healthy eating habits across Nigeria. And that wraps up this week's episode of Health 247 on Rapid TV. Join us next week for a fresh package of Health 247. Until then, eat well, stay healthy, and take care.